Hello everyone. Today's my medicine is ammonium carbonicum. As the name suggests, medicine has symptoms of both the groups, that is the ammonium group and carbonicum group. Ammonia NH3, it is irritant to the respiratory tract, so it leads to asthma, bronchitis or emphysema like symptoms. And the carbon group, it is responsible for hemorrhages, varicose vein, the piles, GIT symptoms like constipation or diarrhea, the physical makeup of the patient, and the patient is sensitive to cold. So, these are the features of carbon group and ammonium group. This is the structure of the ammonium carbonicum. Ammonium carbonicum is a white crystalline powder. Now, its use. It used as leavening agent into the batters, making cookies and crackers. When heating, it readily degrades into the ammonia and the carbon dioxide. It is used as smelling salts, used on the people feeling faint or who have fainted. It releases the ammonia gas that causes irritation to the nasal mucosa and the lungs mucosa. It used in the form of stimulant into athletic competition to wake up the competitors to perform better. This is the bottle, the smiling salts bottle, smiling bottles, and this is the picture that's showing that it is used as smelling salts for the person who have fainted. Now it is used in bronchitis as expectorant. It is used as emetic in smokeless tobacco or the snuff. It increases the pH of the tobacco mixture, so it increases the amount of nicotine available for the absorption by the body. Now the sphere of action and pathogenesis. It is mainly act on the blood. It causes degeneration of the blood, so it causes destructions of the RBC. So there is a decreased amount of RBC and the hemoglobin into the blood, which is reduce the oxygen carrying capacity of the blood, and it leads to anemia. There is a reduced tendency to coagulation. It affects the blood vessels and causing relaxation, which leads to profuse hemorrhages. Now, hemorrhages, they are the dark, watery, offensive, and non-coagulable because it reduces the coagulable tendency. There is a nasal bleeding after washing the face and after eating, which is more from the left nostril. Though ammonium carb is right-sided medicine, but a nasal bleeding which is more at the left nostril. The menses are too early, too profuse, copious flow, long-lasting, and it is more at night and when sitting. There is a cholera-like symptoms at the commencement of menses. There is diarrhea, nausea, vomiting, and this loss of fluids. It leads to great prostration and weakness. There is a toothache during menses. There is a relaxation of the venous system, which leads to venous congestion. So there is a stasis of the blood, and it causes varicose vein and hemorrhoids. These hemorrhoids, they are the bleeding types and protruding types, aggravated during the menses and after the stool or without the stool. The discharge of the blood is before and after the stool, which is better by lying or especially lying on the abdomen, or patient cannot walk because of the protruding piles. Varicose vein on the extremities. The affected area is become cold and blue, and there is a cramp-like pain, inclination to stretch the limbs. On the second is sphere of action is mucous membrane. It causes irritation, inflammation, and acrid discharge. The discharges all which are the saliva, leukorrhea, the menstrual flow, urine, stool, the nasal discharge, the lacrimation, all these are acrid and it leads to excoriation. So the acrid saliva is causes excoriation of the lips. So there is a crackers in the corners and middle of lip. Stool is acrid and excoriating. Menstrual flow, leukorrhea also excoriating. It causes soreness of the parts where it flows. excoriating the thighs. The vulva it become much swollen and there is a burning and itching. On the respiratory system, it acts as irritant. It irritates the nasal mucosa, which leads to inflammation, congestion. So there is a profuse watery coryza which is continuous, and this continuous coryza leads to blockage of the nose, which is more at the night. So patient cannot breathe through the nose. So he or she has must open the mouth. There is a difficulty in breathing which stimulates the parasympathetic system and it causes activation of the cardiac center. So there is a audible palpitations with fear, cold sweat, faintness, tachycardia, lacrimation, and inability to speak. Cough every morning 3 a.m. with palpitation, dyspnea, and burning into the chest, which is more at ascending. Suffocation, spasm of the bronchus, bronchitis, asthma, which is aggravated into the warm room, ascending and better by cool air. Emphysema with much difficulty into the breathing, tiredness, cough after the influenza, weak and prostrated feeling. There's a lots of mucus into the chest, but patient is unable to expectorate it out. So there's a rattling of the mucus. Ailments from sedentary life, exposure to cold, and stormy wet weather. The children dislike washing as seen into sulfur and the antim crude. They're very lazy type and does not like to washing, does not like to bath because they live that sedentary lives. The modality is aggravated from cold wet weather, from washing during menses 3 to 4 a.m. better by lying on abdomen or lying on painful side and dry warm weather.